The prognosis for patients with acute renal failure is directly related to the cause, the absence or presence of pre-existing kidney disease, and the duration of renal dysfunction prior to intervention. The in-hospital mortality rate for acute renal failure is 40 to 50%. The mortality rate for ICU patients requiring dialysis is greater than 50%. On long-term follow-up, about 1 to 10 years, approximately 12.5% of survivors of acute renal failure are dialysis dependent. 19 to 31% of survivors experience partial recovery of kidney function and have chronic kidney disease. Mortality in patients with chronic renal failure in 2009 was 56% greater than that in patients without chronic renal failure. For patients with stage 4 to 5 chronic renal failure, the mortality rate is 76% greater. Life expectancy of a patient age 60 who is starting dialysis is about 4 years, compared to 20 years for a healthy individual. Patients with chronic kidney disease generally experience progressive loss of kidney function and are at risk for end-stage renal disease. Among patients aged 65 years or older who have end-stage renal disease, mortality rates are 6 times higher than in the general population.